Hello, and welcome to my presentation on early gestational diabetes testing and the timing. There has been some discussion among researchers concerning the timing of testing for gestational diabetes in pregnancy. Today, I'll discuss how the timing affects the outcomes of mothers and infants. If you give me a moment, I'll go ahead and share my screen with you so that I can, there we go. Here we are. Okay. Early glucose tolerance testing and outcomes of gestational diabetic mothers. My name is Jamie Neal. I'm a student at Frontier Nursing University, and we're going to talk about gestational diabetes today. First, what is gestational diabetes? It's defined as diabetes discovered during early pregnancy. Pregnant women whose pancreatic function is insufficient are considered gestational diabetic. ACOG encourages completing early gestational diabetes testing in women who have increased risk or other comorbidities. Therefore, many American providers will test a patient at they'll decide at their first prenatal visit if routine testing is appropriate versus early testing. So the screening variables that we use to decide whether routine testing is appropriate or early testing is appropriate are risk factors. Routine testing generally is done between the 24th and 28th week of gestation and pregnancy, and early testing would occur at their first or second prenatal visit. For women with higher risk, early testing is appropriate according to ACOG. And there is some discussion because the American Diabetes Association and the International Association of Diabetes in Pregnancy have a little bit of different opinion about how to test a woman for gestational diabetes in pregnancy. But for women with higher risk, it's usually done with the 1-hour glucose tolerance test. And so if a woman is at her prenatal visit and don't have time for that 1-hour test, then they may have to come back for a second visit. How does gestational diabetes affect maternal health? I outlined it here in two different periods of time. First, perinatal effects. Gestational diabetes can cause a woman to have a macrosomia stomach baby, a baby that's too large, which would have her increased risk for a traumatic birth experience, such as shoulder dystocia or an urgent operative delivery because the baby fetal intolerance of labor or delivery process. After delivery, a woman with gestational diabetes have a greater chance of having gestational diabetes again in later pregnancies, and her risk is increased for chronic hypertension and insulin resistance as well. They could also end up with type 2 diabetes or metabolic syndrome. Here is a diagram with just some examples of risks that are listed here. How gestational diabetes, the risk factors that will affect a woman to encourage a doctor to do early testing. These are some of the most common ones, but the most common one is increased BMI. Obesity in a pregnant woman is the most common reason, most common risk factor that a woman is tested early for gestational diabetes. Early glucose tolerance testing has some benefits, mostly in the obese woman. They seem to benefit the most, and this group is where gestational diabetes is discovered most often. Again, increased BMI is the most common risk factor. Early testing also allows for better management of glucose control. Optimal glucose control throughout the pregnancy is possible when early testing takes place. This is a slide that talks about how we manage gestational diabetes. The first thing that we do is counsel the patient on exercise and diet and monitoring her glucose levels very closely. If after changing her diet and adding some exercise, glucose levels are still uncontrolled, we may order some oral medication, and then insulin would be the next step in controlling glucose levels during pregnancy. Some outcomes that are outlined here for obstetrical outcomes are the sooner a patient is diagnosed with gestational diabetes, the sooner they can be treated, begin treatment, and have a better control of blood glucose levels during pregnancy, in which that would decrease the risk of complications during pregnancy and labor and delivery and after. Perinatal outcomes are outlined as here as the main one is that an optimal labor and delivery experience is more likely when testing is done early. Decreased birth injuries, decreased risk of poor feeding infants, also a decrease in the chance for having an operative delivery. Exploring this topic, I found that there is no evidence or difference in outcomes, whether testing was routine or early. However, every early testing in pregnancy will lead to better management of those patients that are diagnosed early. I want to thank you for your attention today and your time. If you have any questions, please let me know. Here are some references for you, and here we go. We're gonna end the broadcast now in just a moment, but I again would like to say thank you for your attention. And if you would like to discuss anything, just let me know. Have a great day.